and welcome to the core faculty training, Achieving Safe Use While Improving Patient Care. My name is David Bozzo, and I'll be your faculty training person today. I'd like to welcome you to this faculty training and hope that you enjoy the time and learn a lot here over the next 45 minutes or so that will take to complete this program. I have no financial relationships to declare. Well, let me talk a little bit about what we're going to be going through today. First and foremost, any good educational program starts with learning objectives. And your learning objectives for this program are as follows. First, we're going to have you understand the extended release long-acting opioid REMS program, and in particular the FDA's role with regards to this. We're going to have you understand the evolution of how CoreGuard started and what this initiative is all about. We want you to appreciate your role as part of the core organization after today's training. We want you to express confidence in your ability to present the standard core material, and we'll be going through that today, and it'll make you at least initially familiar with it. And then we're going to have you understand the importance of encouraging your learners to take the assessment. I'm going to be mentioning this multiple times throughout this program here, but this is one of the key components. It's very important that we have all of our learners complete the assessment program at the end. And finally, we're going to ask that as a faculty member that you provide feedback to us so that we can do some continuous improvement on this program and have it evolve as time goes on. Why are we here today? Well, let me start with a little story about some important things with regards to prescribing, especially the long-acting extended release opioids. First and foremost, I want you to understand that we're here to really ensure that patients' pain is treated properly. That's one of our main goals here. Secondly, we also want to ensure that patients who are prescribed opioids are educated to use them in a safe manner. This is going to be very important as we go along because not only do prescribers need to know how to prescribe, but patients also need to be educated on how to use these safely. We also want to ensure that people who misuse or abuse opioids don't get them. And finally, we want to focus a little bit on how to protect practices. One of the main points that brought about this FDA program had to do with the statement that's listed here on this slide. The misuse, abuse, and diversion of extended release long-acting opioids is a national public health crisis. Let me show you some of the data with regards to that. In 2009, 39,000 Americans died from drug poisonings. But when we looked a little more closely at that, nearly 15,000 of those deaths actually involved a prescription opioid medication. And now that is really just the tip of the iceberg as displayed here in this cartoon that you see here. For every death, there was actually 10 treatment admissions for abuse, 32 emergency department visits for misuse or abuse, 130 people who abuse or are addicted, and finally 825 non-medical users of extended release long-acting opioids. This is, in fact, a national health crisis, and these numbers here are just incredible, and which is why we're bringing in this program today. Let me talk a little bit about what REMS is and give you a little greater understanding with regards to that. REMS is a program that began with the FDA, and it was through the 2007 Food and Drug Administration Amendments Act. And what this did is it empowered the FDA to take medications that had a particularly serious known risk or some kind of problem associated with it and actually have extra education delivered on these medications. Again, these really related to biologic products and drugs where the benefit outweighed the risk, but the risk was perhaps a little bit higher than it would be with other medications. Now, this type of education in the past for REMS can include medication guides, package inserts, a communication plan, and other elements to really ensure safe use. Also included in this was prescriber education. Now, there are many drugs that have undergone the REMS process. Some of those are related to the medication Accutane, for example, that had problems with females in particular and being a pregnancy category X medication. I wanted to give you a little bit of additional information on this particular REMS. This one's a special one in that this is a single program for all extended release long-acting opioids. Now, the responsibility for the funding for this particular program does lie with those 20 manufacturers or so that do produce long-acting extended release opioids. However, all of the content does come from the CORE collaborative of all of the organizations that are involved with CORE, and they are solely responsible for the content of this program. Now, this education is really meant to target all prescribers. We're going to be talking to MDs, DOs, nurse practitioners, and physician assistants in specialty programs as well as in primary care. Now, this does not include pharmacists, but it does include all the prescribers that I've listed above. Now, the content of this program was really specified in the FDA blueprint that was released in July 2012. At this point in time, this material and this education is voluntary for all prescribers. Now, this is the first time that the FDA has actually mandated that accredited education be used in a REMS product or in a REMS cycle here. Now, this is very interesting because there's some challenges that are associated with this. What the FDA did with their blueprint is really provide that material that needs to be covered. Now, what you will see is that this material is quite extensive. However, they also threw a little bit of a challenge in front of us with regards to doing this, in that they said that they really didn't want the length of the program to be longer than 3 hours. So the challenge to us is, how do we go through all of this material, all of this education material in under 3 hours? And that's where the process lies. Now, don't fret at this point in time. We do have a very good program in place that I'll describe to you a little bit later. And also, we're going to have some other materials that are available to both you and the learners to help make sure that they do learn the material and have access to some support tools later on. What I wanted to talk about is some of the goals that the FDA has actually put in place here. And this is some pretty lofty goals. You can see here that by the end of 2014, they're hoping that about 80,000 prescribers have been reached. Then by 2015, 160, and then finally by 2016, 320,000 prescribers. So this is going to be a long, ongoing effort, and it's going to be quite extensive to try to reach a lot of people. The FDA has also put in front of us some very specific definitions, and I'd just like to take a second to go through those with you. The first is a learner, and a learner is someone who has actually participated in the course where the curriculum covers the entire FDA blueprint. The next definition is someone who's considered a completer. This is someone who has gone through all of the material in the blueprint, but in addition, they have taken an assessment, and we're going to be, again, talking about this assessment here quite a number of times here through this presentation. But the completers have actually done the assessment part of the project at the end of the presentation. And then finally, there's someone who's going to be called a successful completer. So this is someone who has done the FDA blueprint program, they've taken the assessment, and in addition, they have actually prescribed a long-acting extended release opioid in the last year. Let me explain to you a little bit about CORE. CORE is made up of 10 member organizations that have come together from multiple disciplines to put the curriculum for the extended release long-acting opioids together. Now, this is a very educationally sound program in that there was a needs assessment performed, practice gaps were identified, clinical competencies were considered, and learner self-assessments were put into place really to meet the needs of the FDA blueprint. And again, as I mentioned, our ultimate mission is to make sure that these medications, when prescribed in the manner, really enhances the patient care experience as well as keeping the public safe. With regards to the partners that are involved in CORE, you can see the list here of the 10 main organizations who are the founding partners. As you also see, there's 3 strategic partners that are involved and also educational advisors. Now, some of those names you may actually recognize as educational leaders that have been really well known and renowned here in the United States with regards to putting together excellent educational programming. Again, these are just the organizations, and I'm hoping that some of you will recognize the organizations that are listed here, and in fact are very likely members of one of these organizations. Let me give you a little brief history, because this has been a project that has been going on for at least 3 years now. In 2010, the CORE program was formed. Signed partnerships were put together, and competencies were also put together with regards to this extended release long-acting opioid prescribing. In 2011 was where we really started to get busy with doing some research and planning. Needs assessments were done, and in fact one of the most extensive needs assessment program was put together. In 2012, after the needs assessment was collated and the results were obtained, we were able to put together the content of the material and design the meetings. Then in 2013 was really when we started to launch the program, and we started to deliver our educational programming. And let me just highlight here again that the educational programming comes in multiple modalities. There's live programming, there's online programming, there are written materials, as well as educational materials that can be provided to all learners. CORE is quite strong. If you look at all of the member organizations that are involved with CORE, we encompass almost 700,000 clinical members. Again, this is an extremely strong and very large organization. The full continuum of targeted prescribers from MDs, DOs, NPs, PAs, as well as cutting-edge researchers, addiction specialists, pain management specialists, and other expert opinion leaders all came together within the programs that are listed there. We are also accredited by every accrediting body, and you can see the ones that are listed there. And we have had almost 3 years of some very important programming that has gone into creating the content that you will be delivering. I wanted to spend a little bit of time here on the needs assessment and the research survey, which occurred in 2011. As I mentioned earlier, this was a very extensive program that took place. There was approximately 50,000 surveys that were sent out, and we had a fairly reasonable response rate at 21%. In addition to that, there was 40 90-minute qualitative interviews with learners, and then an extensive literature search was done in regards to rounding out all of the materials that help form the content that you're going to be delivering. Now, if you would like to get access to all of this, it is available at the corerems.org website that is listed at the bottom of the slide. These are the content experts that were actually involved in putting together the initial program with regards to the Core REMS education. And these are some of the photos that took from the working groups that took place when we were putting the curriculum together. It was a very collegial group. We spent a lot of good hours together and really put together what we think is a very strong program. Let's talk a little bit about the reach and the educational design that took place here. With regards to the reach, as I mentioned earlier, we have nearly 700,000 clinician members who we get through the 10 organizations plus our 3 partner organizations with regards to CORE. Now, additionally, there's about 600,000 physicians that are subscribed to Medscape that will have access to this education, 76,000 NPs and PAs, and 225,000 ERLA prescribers as well. I do want to mention that you are already joining a fairly large group of faculty members. To date, we have had approximately 100 faculty that have been trained. I also wanted to talk to you about the organizational channels that are ongoing with this program. We're going to be performing in this first year about 150 live meetings. These will take place at national, regional, state, and specialty meetings that occur. We're also going to have 9 online activities that are going to be delivered nationally through Medscape and other associations. We also have a core iBook that has been published, in addition to the website material that are going to be available on the corerems.org. In addition, we have with our partner programs, we are going to have direct access to members via email, newsletter, journals, magazines, and bulletins. So you see this really rounds out an entire methodology for reaching learners in multiple modalities. Let's shift gears a little bit and talk about your roles and responsibilities as you become a core faculty member. First and foremost, core has a commitment to you. We will provide you with a strong curriculum that adheres 100% to the FDA guidelines and the blueprint. We are going to provide you with effective tools and resources, both required materials as well as optional materials to support the curriculum that you're going to be teaching. We will also provide you with ongoing support, resources, and any supplementary materials as it becomes available. And finally, we're going to acknowledge the exceptional work that you are doing and the difference that you are actually making in patients' lives. With regards to your responsibility to core, really we want you to serve as the clinical expert who can confidently guide the learners through the content, really helping them achieve increased confidence and competence by helping them balance the benefits as well as the risks with regards to prescribing extended release long-acting opioids. We want you to serve as an ambassador for core. You're going to be out there representing core, and really the goal of our organization is for safe practice prescribing, safety for our patients, and we want you to be the ambassador delivering that message. We're going to ask that you very closely adhere to the FDA's blueprint and the core curriculum. This is important for us because this is a requirement through the FDA that all materials really strictly bind to the blueprint. Finally, we're going to ask you to really encourage your learners to take the assessment. Again, this will make certain that they are at least completers, and then if they are also prescribers, then they can be reach the highest level of completer. Let's talk a little bit about the curriculum. Now, at this point in time, most of the programs that are going to be delivered are of the 2-hour or 3-hour variety. I will tell you that both of these do meet all of the requirements of the entire FDA blueprint, and people can be course completers after this. Again, if they've been prescribers, in addition to completing the 2 or 3-hour program, they can also be what's called a successful course completer. Now, if you look at the 2-hour program, there's about 120 slides that covers all the materials. If you do the 3-hour program, we've extended that to 159 slides. And in addition to delivering the material, we've also thrown cases into this to make it a little more appropriate and perhaps a little bit easier for our learners to go through patient cases to understand the material being delivered. Also, we're going to have online courses available through our website. And in addition, we'll have the materials delivered through Medscape, as you see listed there. Now, there are going to be some partial completer activities. These are programs that are under 2 hours in length, mostly 90 minutes. There may be some shorter ones, but this will only be partially going through the FDA blueprint. We will then ask the participants to come back to the website or use one of our other learning methodologies to get the rest of the material at that point in time so that they can then become completers and hopefully successful completers. Now, in going through the program, there's going to be an introduction and then 6 different units, and I'm going to go through each of these one by one here over these next slides. Again, this is meant to be a general overview for you. We are going to supply you with the entire amount of information, including a faculty guide that includes all of the materials from the slides in addition to the references and background information. So starting here first with the introductory slides, you're going to really be talking about the products that are included in the REMS program. You're going to be talking about the importance of prescriber education. You're going to actually go back and use one of the slides that I showed you earlier regarding the opioid abuse epidemic here in the United States, and then finally cover the responsibilities of opioid prescribers. We also like to ask you to add a brief personal story at this time. This helps deliver your message and makes it a little bit more memorable to our participants. In Unit 1, we're really going to be talking about how to assess the patient for treatment with the extended release long-acting opioids. So before prescribing, it's important to go through a complete patient history, and in particular a pain history, and talk about different treatments that they've had for pain in the past. We're going to be talking specifically about general physical exam, but also specific physical exam that's going to be important when you are considering using extended release long-acting opioids, and also talk about the risk of abuse. We're going to be describing and sharing with you a number of tools that are available to assess the patients before prescribing ever occurs to determine their level of risk with regards to abuse for these medications. We're also going to talk about the concepts of opioid trials, and then if you choose to do the extended program, then the case here that's going to be used is Peter. With regards to Unit 2, this is where you start educating your participants about initiating therapy, modifying dosing, and then finally discontinuing the use of extended release opioids. The first thing we start out here is talking about federal and state regulations. Now, one of the tacks that I have taken in the programs that I have already delivered is, depending on whatever state or jurisdiction I'm going to be delivering the education in, I go through and I look to see what their local laws are. And this could be state laws or even some local laws that may exist in their jurisdiction. And then I talk to them about that and try to give them the information on where to find information that's specific to them. After that, we talk about initiating therapy. We talk about opioid naive patients and opioid tolerant patients, because there is a little bit of difference with regards to initiating therapy in each of these two groups. We then talk about converting from short-acting to long-acting opioids. We talk about dose selection and then titration. This is the first time that we'll bring in the information about opioid side effects. Again, this is where the patient education comes in, and really the most important opioid side effect that we're going to be talking about is respiratory depression. And we're going to educate our prescribers to educate their patients and family members, or those who will be around the patient, on what are some of the signs of respiratory depression or side effects associated with the medication. The next topic we're going to cover in this section is called opioid rotation. We're going to talk about the concept of incomplete cross-tolerance and really go over equal analgesic dosing. Again, this is a topic that I think many are familiar with, but as you'll see in the education, there are some nuances that will be important to get across. Finally, we'll talk about tapering and discontinuing dosing and what's proper methodology to do that. And as you see, there's two cases here that to help you describe that in the longer program. Unit 3 is going to talk about managing therapies with extended release long-acting opioids. This is where we start to get into patient-provider agreements with regards to extended release long-acting opioids. We're going to talk about how to monitor patients, and the monitoring includes not only informing the patient of risks and benefits, and for us to assess whether there's a continued need for them to have therapy, but also to talk about adherence, talk to them about aberrant drug-related behaviors, and talk to them about function and pain control, as well as adverse side effects that may occur with these medications. Finally, we're going to be talking about a couple of other ways to monitor your patients, and that has to do with prescription drug monitoring programs. Again, this is going to be specific to the state that you're presenting in, but it's going to be important to talk to prescribers about that, how to utilize those programs with regards to monitoring patients, and then finally the use of urine drug screens to monitor their patients as well. Unit 4 gets a little bit more into counseling, specifically the patient, but also the caregivers, about the safe use of extended release opioids. The details of this unit include how to counsel patients on the proper use, and this involves how to properly take these extended release opioids, what are some of the common adverse effects with regards to these opioids. We're going to describe to them that it's against the law and really not recommended for them to share or sell their medications. We're going to talk to them about the safe storage of their medications. Again, topics that you may not initially think about doing. And then finally, we're going to talk about how to dispose of these medications. Now, we're also going to include the caregivers here, and we want to talk to caregivers, first of all, to look for any side effects or warning signs that take place in the patient themselves, but also characterize some of the misuse and some of the diversion that may in fact happen, not with the patient, but perhaps with other people that are living in the house. We're going to be providing documentation and, we're going to be providing documents for you to refer your prescribers to so that they can use these with their patients. And then the case study here is a patient named Anne. Unit 5 is the next section where we're going to actually be talking about general drug information with regards to the class of extended release long-acting opioids. We're going to cover here in this case specific drug-drug interactions. We're going to talk about the concept of tolerance of opioids and how that develops. We're going to talk about the different delivery mechanisms with regards to these extended release long-acting opioids. And we're really going to talk about some of the characteristics of the drugs as a class, and specifically use limitations, dosage reduction for people that may have hepatic or renal failure, and drug interactions that are common to this class. And then finally, we're going to be talking about contraindications to using the medications in this class at all. Unit 6 is where we actually get into the specifics of each and every one of the drugs that are covered by this extended release long-acting opioid program. We're going to specifically go over drug characteristics, and you can see here the specific medications that we'll actually be including in this section. Finally, I wanted to talk to you a little bit about some additional curriculum tools and resources that will be available to you and to your prescribers that you're going to be educating. And this includes patient education tools, assessment tools, communication tools. We're going to be giving you links to websites that will be helpful, state-specific regulatory slides. And in addition to that, we're going to be, again, supporting you with any additional materials that you might need to help enhance your presentations. All of these tools and materials are going to be available to you through your staff contact members or by contacting the core program directly. Now, I wanted to get back to this idea of the evaluation and the assessment. And again, I told you I'd be mentioning this a lot through this talk, and this is because it's very important to us. This is, in fact, how we report to the FDA that people have completed the program. Now, the way this assessment has been put together is these are questions that are very similar to what you might see on a board type examination, and they cover all of the content specific in the FDA blueprint. They're really designed to assess the knowledge and competence of the folks that take our program. They consist of case-based programs. These are clinical vignettes with multiple choice questions. Now, the number of questions will vary depending on the presentation and the time that you are giving your activity level, but 14 is the minimal number to cover the entire FDA blueprint. Now, we're going to have several formats available for the prescribers to take this assessment tools. It'll either be done online, it'll be done via paper, or with a Scantron sheet. We are going to be tracking and reporting all of the people that complete our assessment. And as you recall, we have total completers, which are the people that actually complete the assessment after going through a 2 or 3 hour program. And then finally, the successful completers. And it's really the successful completers that the FDA is most interested in. They want to see that people who are prescribing and using these medications have gone through the education and have displayed some level of competence with regards to the questions in the assessment. Your goal as a core faculty member and as an ambassador for core is to really encourage your participants to go through and take the time to complete the entire assessment. One of the strategies that I've implemented with regards to trying to get our participants to complete this is to actually take a little time out in the middle of your presentation. And generally what I do is I will stop at the appropriate time and I'll tell them, okay, go ahead and complete questions 1 through 4. This gets the process starting. It gets them thinking about the assessment. And then once you reach the end of the assessment, they complete the rest of the questions. In addition to reporting to the FDA, some other outcomes that will be realized by our assessment is that it will provide us a foundation for formative assessments and then continual quality improvement with regards to the presentation and the materials. It will also enable us to compare and contrast the effectiveness of the various programs with regards to how we deliver the materials to our prescribers. In addition, it will allow us to assess the efficacy of what we're doing. Are we delivering an educational program that is pertinent and relevant that allows our prescribers to end up with increased knowledge, competence, and then turn that into performance? And finally, as I mentioned earlier, this will comply and complete with the FDA requirements for the core REMS program. And remember here, it is going to be really incumbent upon you as an ambassador of core to make sure that your providers and prescribers do complete the assessment. It's really very important, and I think I've emphasized that point here today. Now, with regards to faculty support for you, as I mentioned earlier, we will be completely available to you. We will make sure that you get any curriculum updates as they happen. They will be sent out to you as a registered faculty member. And if any concerns or any problems come up, you will have our contact information to let us know which way we can help support you and make you a better faculty member representing core. The website that is listed there again, core-rems.org. I'd like to thank you very much for attending this program today, and please know that this is not the end. You will be getting your materials, your information, and we will be providing you continuous support throughout this. We'd really like to thank you very much for becoming a core faculty and really appreciate the efforts and the time that you're putting into this and really making prescribing of these extended release long-acting opioids much better for our patients and much safer for everyone involved. Thank you very much.